Hello, today we are going to be talking about the regulation of histone and non-histone protein acetylation and its implications in non-small cell lung cancer. Just to provide a quick overview, we will give a background on non-small cell lung cancer. We'll talk about the importance of a balanced regulation of histone acetylation, as well as the consequences of an imbalanced level of histone acetylation, as is found in non-small cell lung cancer. We'll be focusing these effects on the epidermal growth factor receptor, as well as the Kirsten rat sarcoma viral oncogene homolog, or the CRAS gene. We'll be talking about the new applications of histone deacetylase inhibitors as a potential therapeutic treatment for this disease, as well as setbacks to the use of these inhibitors and proposed solutions for the setbacks and future directions.
So some general information on non-small cell lung cancer. This accounts for 85 to 90% of all lung cancers and consists of three subtypes known as adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Non-small cell lung cancer is also the most common cause of cancer-related deaths and is usually not diagnosed until advanced stages. Due to this late diagnosis, there's limited therapeutic treatments available, and the prognosis is extremely poor with an 18% 5-year survival rate. There's around 221,200 new cases each year worldwide, and non-small cell lung cancer is directly correlated with histone acetylation, which is an aberrant epigenetic modulation. This means that the balance between HDACs and HATs is extremely important in preventing this cancer.
So histone acetylation is an epigenetic mechanism that affects the expression of genes due to the conformational change it induces on the organization of chromatin structures. And the balance of this process is maintained through two enzyme families, the histone acetyl transferases, or the HATs, and the histone deacetylases, or the HDACs. Histone acetyl transferases catalyze the addition of an acetyl group onto the lysine residues on the N-terminal tails of histones through employing acetyl-CoA as a common acetyl donor. This process results in the termination of the positively charged lysine, thus destroying the electrostatic interaction between DNA and histones. And this in turn relaxes the structure of chromatins, opening up a region that is more easily accessible to transcription factors. In contrast, histone deacetylases catalyze the removal of the acetyl group from the lysine residues, and this in turn results in transcriptional repression and can lead to silenced gene expression. And the balance of these two enzymes is very critical for a healthy typical gene expression, where genes that need to be turned on are turned on and genes that need to be turned off are in fact turned off. But this balance is heavily thrown off in cells exhibiting non-small cell lung cancer.
So an imbalanced regulation of histone acetylation in non-small cell lung cancer can lead to a mutation in some genes and the silencing of others. One of the most common genes mutated in 20 to 40% of non-small cell lung cancer patients is CRAS. So CRAS genes contain RAS proteins, and these proteins are involved in the progression of cell cycle and cell survival. They are regulated by GAPs, or GTPase activating proteins, and guanine nucleotide exchange factors, known as GEFs. In the figure to the right, you can see the functions of these regulatory proteins. As GAPs stimulate the inactive GDP-bound state of RAS proteins through hydrolysis, GEFs will stimulate the active GDP-bound state through exchange for GDP for GTP. As CRAS genes usually undergo transversion or transition mutations in non-small cell lung cancer, it can lead to an overactivity and eventually go to proliferation and tumor growth. Ultimately, mutated CRAS genes lead to a decrease in the function of GAPs and an increase in cell growth. In addition to CRAS genes, the overexpression of HDAC1 will occur, as well as EGFR mutations. As HDAC1 becomes overexpressed, it loses the control of specific proteins and is unable to regulate TP53. TP53 is a tumor suppressor gene commonly silenced in almost all types of cancer. And when EGFR genes undergo mutations, it's no longer able to regulate the proliferation of cells. And EGFR is consists of three components, one of which is an extracellular ligand binding domain. This domain is ultimately responsible for the heterodimerization and the dimerization of receptors. When no ligand is present, the receptors relay no activity and will lead to an overexpression and cause rapid autophosphorylation. Ultimately, the EGFR genes lose their ability to regulate normal functions.
So due to the overexpression of histone deacetylases as found in non-small cell lung cancer, histone deacetylase inhibitors are being explored as a way to regain this balance between the histone deacetylases and the histone acetyltransferases. Histone deacetylase inhibitors are composed of both natural and synthetic compounds, and they possess several agents that are found to be reversible or irreversible inhibitors of histone deacetylases. Their effects have been studied as a monotherapy as well as in conjunction with other approaches, including but not limited to cytotoxic chemotherapy, immune checkpoint inhibitors, tyrosine kinase inhibitors, radiation, DNA methyltransferase inhibitors. And while they have shown some promising results in their use as a monotherapy, it's not nearly as effective as when used synergistically with other courses of treatment. And there are a multitude of mechanisms and pathways in which these inhibitors are able to exert their anti-cancer effects. And we will be covering some of those in the presentation. In the figure on the right here, you can see the most basic mechanism of these inhibitors. So on the top here, you can see that the histone deacetylases are removing an excess amount of acetyl groups, and that results in a more condensed chromatin structure. However, in the bottom portion of this figure, you can see the inhibitor is blocking the histone deacetylase from catalyzing the removal of these acetyl groups. And this in turn results in a more relaxed chromatin structure that is more easily accessible by transcription factors. So one of the ways these inhibitors are being studied is in their effects on reversing cisplatin resistance. Cisplatin resistance is a major issue in the treatment of this disease, and it stems from an overexpression of a gene called excision repair cross-complementing 1 gene. And this gene plays a major role in the regulation and excision of damaged DNA, and it's been shown that a high level of the expression of the ERCC1 gene leads to an increased resistance in cisplatin. Now, histone deacetylase inhibitors are able to resensitize these cells that exhibit high levels of ERCC1. And this works by the inhibitor acetylating and thus activating E2F1, which is a transcription factor that is responsible for then inhibiting the ERCC1 gene. This in turn results in an increased expression of MIR149, which is a microRNA that holds significance in post-transcriptional gene regulation. MIR149s have a high affinity for specific regions of mRNA where they're able to inhibit translation or even prompt mRNA degradation. The specific mRNA target regions of MIR149 regulate numerous cell processes that relate to cell differentiation, apoptosis, in addition to drug resistance.
So as a potential HDAC inhibitor treatment, we have vorinostat, and vorinostat is among one of the first HDAC inhibitors that were approved by the FDA to be used as a treatment for non-small cell lung cancers. As a monotherapy, vorinostat can work by upregulating P21, which is a cyclin-dependent kinase inhibitor, leading to a loss of telomerase activity. This will induce cell cycle arrest at G0 to G1 in human cell lines and eventually stop the growth of cancer cells. Vorinostat in combination with current forms of treatment is currently being studied as a potential treatment for non-small cell lung cancer. And as a radiotherapy, vorinostat can work by activating caspase 8, which is a cysteine protease responsible for initiating apoptotic signaling pathways. As it increases ionizing radiation sensitivity, it has the potential to improve efficiency in radiotherapy. And despite the potential benefits that inhibitors have on non-small cell lung cancers, there is also a couple setbacks to account for. So HDAC inhibitors are extremely experimental. There hasn't been a phase 3 clinical trial done yet in testing the application of these inhibitors on patients. And it also has an extremely toxic profile. This stands as a major setback, especially when combined with cytotoxic chemotherapy. And some of the side effects will include cardiac toxicity, and long-term effects can go up to gastrointestinal side effects as well as immune suppression. To address these setbacks, HDAC inhibitors as a treatment for non-small cell lung cancer is being developed to be more selective in maintaining off-target toxicity.
So, as Abby had just mentioned, a lot of the potential solutions and future directions are aimed at increasing the specificity of these inhibitors. And this is currently being achieved through the use of new technologies such as nanocarriers, which are being used in the administration of these inhibitors as a more robust targeted delivery. A pitfall of many drugs is that they diffuse nonspecifically, and this enhances damage done by collateral toxicities, especially when the drug already has a very high toxic profile, as seen in histone deacetylase inhibitors. Nanocarriers are a novel way to deliver these drugs, and they offer tumor specificity in addition to a more controlled release. And this is done through the use of nanoparticles, which are engineered. This is what you're seeing in the picture on your right here. That is a engineered nanoparticle that is designed to be more attracted to specific cells that are affected by non-small cell lung cancer. And this allows for a more direct and localized treatment and mitigation of off-target toxicity. In addition to this, developments of more selective histone deacetylase inhibitors are being explored as cells exhibiting non-small cell lung cancer have an increased expression of class 1 histone deacetylases. An inhibitor that is tailored to inhibit this specific enzyme is imperative for an effective course of treatment.
So to sum it all up, non-small cell lung cancer is ultimately caused by an imbalance of HATs and HDACs, more specifically the overexpression of HDACs. This overexpression causes the mutations of KRAS and EGFR genes, as well as silencing of TP53, which is a tumor suppressor gene. HDAC inhibitors is currently being studied as a potential treatment in benefiting the prognosis of non-small cell lung cancer, and this can be seen in the forms of cisplatin resistance as well as vorinostat. And to recap, vorinostat works by increasing the efficiency of radiotherapy while also working in monotherapy to stop the growth of cancer cells. HDAC inhibitors have shown the results of being more effective when paired with other treatments, and there are currently more studies being done to improve the effects of these inhibitors. And as of 2020, there are 615 ongoing clinical trials that actually support the effects that HDAC inhibitors may have as in monotherapy or combination therapy. With that being said, HDAC inhibitors have shown and continues to show potential for being an effective treatment for non-small cell lung cancer patients.